Welcome to Optimizing Your PI Case Outcomes, spinal testing that builds six-figure cases. I'm sure you've all been there before. You have a client with subjective complaints, providers are giving treatment, care, and management, and yet they can't find any objective findings that correlate with the patient's symptoms. Here's a perfect example. This is an actual failed six-figure outcome. The patient was a medical provider, was complaining of lower back and hip pain after their motor vehicle crash. During the course of their PI case, had 3 MRIs, all negative. Ultimately, the case had to settle. Can't go on forever, which led to a poor legal and clinical outcome. Not only did they not get the liability limits, but they were unable to access the patient-client's UIM. Now, why were all those MRIs negative? Because the patient didn't have a disc issue. They had a spinal ligament instability as demonstrated right here, both at L2, L3 and L3, L4. Significant if it was captured during the PI case. Unfortunately, all of this happened post-motor vehicle crash. The VMA, the Vertebral Motion Analysis, provides an objective, defensible diagnosis of ligament injury and the injury severity, so cases can settle between 90 to 120 days from the date of the accident for policy limits. The Vertebral Motion Analysis is an FDA-cleared and patented diagnostic that analyzes both the cervical and lumbar spine in real time to find spinal ligament instability pathology. This technology finds injuries that MRI and standard X-ray miss. It diagnoses, objectifies, and quantifies the injury. And as you already know, spinal ligament instability is a high carrier software value driver. Improve your PI cases with accurate, consistent, and reliable testing that's been called the technology of the future. Thanks for watching, and stay tuned for more information.